my breath. It's already started time. My name is Mari-Carmen. I'm a mother of 3. Arthur is 9, Florence is 7, and Archibald will be 3 next month. And I started my journey as a paediatric intensive care nurse. So this is all about what motherhood made me build. So that is a picture of me with my Archie, who will be 3 next month. And that's the photo of where it really started. So my story started there, but it ends, this is where my story ends today, but it didn't start there. So I want to take you back to when I was 14 at secondary school. So I'm not from London, I live in Leamington Spa. I went to a Catholic secondary school. Primary school was always quite pleasant, I've got lots of fond memories, but then went to secondary school and found it really hard. Found it very hard to make friends, found that I had to fit into spaces that I didn't really feel that were my own. And I always remember the dinner hall, a big, big room like this with blue walls. And it was lunchtime and I had to go and find somewhere to sit. And I didn't have many friends. I was like, where do I sit? So standing in front of here today with all you people, I've had to do a lot of work to overcome this. And that was really, really hard for me. And throughout my whole secondary school life until I reached sixth form, I found that I had to really change shape to fit in, with those friendships. And I always felt that I wasn't enough. Anyway, I went to sixth form. Sixth form was much better. Graduated from sixth form and went to Nottingham University to train to be a children's nurse. And I did my studying at Queen's Medical Centre in Nottingham. And I started, had my boyfriend at the time, got there, and I absolutely hated it, not because I missed him, I just hated living in halls. So my parents bought me a Fiat 500, which I still drive now, and I would drive up and down the motorway to my shifts at work, because when you're nursing, if there's any nurses in the room here, going to uni, you're not drinking, you're studying and you're working long hours. So anyway, I did that for 3 years. It was hard, but did it, and I graduated with a first-class honours degree. I then went to work at Birmingham Children's Hospital because I knew that's where I wanted to work, a prestigious hospital. And because I like a challenge, I started my career on paediatric intensive care, and that's where I stayed for 7 years, looking after some of the sickest children. But throughout my time, I always knew, I was always looking for the next course. I was always kind of made for more. But during that time, I looked after lots of children, and one little boy, I'm going to share that story with you now. His name was Ben. And he spent 9 months with us in and out of PICU and the oncology ward. And he was sadly diagnosed with liver cancer after just a freak cold that manifested into a rare cancer. And he did pass away, bless him. But during his time on PICU, he wasn't always ventilated, which meant we could have quite a lot of conversation. And I built a lovely relationship with the family. But he was so strong, no matter what was given to him, he just carried on. And I think I always look back on Ben when we're so busy in our lives and we're striving for the next goal, I think sometimes we can really lose fact of what actually really matters. And actually, Ben, no matter what he was thrown, carried on, and it just really teaches us of what actually really matters, and it's your health. I then married my husband, who I've been with for now 18 years. He's a firefighter. I was a nurse. And then we went on to have our first child when I was only 25. At the time, I was still nursing. So I spent my career for looking after very tiny babies, but that's when I became a mother, and that's when I really changed. But that's when the system stopped seeing me. My baby was cared for, but I wasn't. So I had an emergency C-section via a general anaesthetic and was discharged home only 24 hours later. And I was only 26, so wasn't awake for the first cry, wasn't awake for the first feed. It was quite a traumatic experience. Luckily, I was okay, but I did know I wanted to have an appointment with the birth listening line so I could make an informed decision for my second child as to whether I would go for a VBAC or a C-section. But it took 9 months. Anyway, during my postnatal journey, I didn't get much support with my own health, so I thought, well, I'm going to create this. And I had friends at the time that were photographers that had their own business. They were like, just start. Anyway, so I started my health and fitness business that was called Mari-Carmen Fitness. You can still see it, it's still around, but my husband runs that now. And over the last 8 years, we have supported over 1,000 mothers. And every story from the mother is the same. No one prepared me for this, no one checked on me, the system failed me. So anyway, during that time, I was like, I'm going to build an app that everyone can access. And it was a fitness app. But that wasn't enough, because content isn't care, and an app wasn't a system. I was like, no, it needs to be more than this. It needs to be clinical grade. It needs to have an action at the end that a mother can something they can get from. And that's where Matresa was born. So I knew I'd have to go out and get investment. So I went and pitched to loads of investors. It took me about 12 to 18 months. I was a nurse. I had no idea what I was doing. I thought I was ready. I really wasn't. But I got it. So in February 2025, I was about to sign my investment, and something happened, and it got taken away, like that. And meanwhile, we was up to our eyeballs in debt, because I'd bootstrapped my business. My husband was a firefighter. We've got 3 kids. Firefighters don't earn lots of money, as you're probably aware. And this investment was going to give me time to be able to build the business, pay myself a little salary so I could concentrate, but it was gone. Went home, my mum was looking after my 3 children, and my husband was there. And I cried. I was like, what do I do? And for a week, I sobbed, and I thought, do you know what? I really leaned into my Catholic faith, and I thought, do you know, there's a reason for this. Whenever you're faced with something, there's a reason for it. And Matresa was not what it was 12 months ago as to what it was now. So actually that no was a huge redirection, and I'm so grateful for it now, because the business as to what it is now is so much better. It's so much more. We know exactly what we're building, and we closed our round in January with the same investor. So we raised £315,000 of venture capital and angel investment to get us on the road, and we're launching this summer. And what we're building is a clinical grade maternal health platform that sees the mother, health and work all in one place, because they can't work in silos. It has to come together. So I wanted to share 3 wisdoms. So number 1, the no that breaks your heart is often the thing that saves your life. Often when you're given a challenge, it's very easy just to think, oh, that's it, stop. But actually, there's always a reason for it. And when life is against us, I think we've just got to lean in and just think there's a reason for this. And it's still, even today, I still follow that. Number 2, the little girl in the dining hall isn't the enemy. She's the reason. Now, I've got 3 children, a boy, a girl and a boy, and I look at my daughter. When you said that was quite emotional. And she's only 7, and I'm like, do you know what? I don't want her ever to feel that she's not good enough, and she's the best that she can be. She should never feel that she needs to change shape to fit in. And yes, that little girl is still here now. You know, we've all got childhood trauma, and a lot of the time you might just push them to a side, but actually we have to bring it together. And she's still there, but she's, she keeps me grounded and she keeps me humble, and she's also part of the story, and this is quite a good story to tell. But at the time, didn't feel like it. And number 3, boldness isn't loud. It isn't fearless. Boldness is the quiet decision to stop changing shape. So this isn't just my story. What fuels me is actually the change that I'm so committed to do, because every mother is being told to cope. If there's mothers in the room, you will relate to this. You're told to bounce back. We're praised for being superheroes. We're praised for being resilient. But resilience isn't healthcare. The system was built this way. It isn't your fault. I'm not building a product. I'm building the infrastructure that motherhood has always needed, but no one's ever done it. For every mother who's felt invisible, for every mother told she was doing amazingly whilst quietly falling apart, and for every woman who walked into a room and didn't know where to sit, this is for you, and you can absolutely do it. So to close, the girl in that dining hall didn't know any of this. If you'd have said to me when I was 14 I was going to be an entrepreneur and raise venture capital funding, I would have laughed. But you know what? I did, and I kept going, and that's the only thing boldness has ever really been, and something that I really live by is it only ever fails if you quit. As long as you keep going, you pivot, there's going to be bumps in the road, you just have to keep going. Now, I will ask for a shameless ask. We're launching this summer. There is a QR code there. We are commercialising into B2B2C, so we're looking at working with organisations as a maternal health benefit whilst we navigate the NHS, because we all know that's very difficult. So if you work for a company and you are C-suite senior level and you think that you could do with better maternity support, then get in touch. And if you are an investor as well, we do have a round open. Please come and speak to me. But yeah, thank you very much, and thanks for this opportunity.